All right, we're live.
Hello, everyone. So today's Thursday, and we are back for another topic about cybersecurity. And again, my name is Farah Joseph. I am your host, and with me, I have.
Wilson Joseph, and I am the Chief Operating Officer of Level 3 MD.
Today, we are talking about an important topic. We are talking about why cybersecurity matters for healthcare professionals. So all know that healthcare is one of the biggest target for cyber attacks. So we decided to talk about that. We'll be discussing about critical data, compliance, and liability. All right. So stay with us. We'll be discussing it with you. And as you know, you can always write your comment, or if you have any questions, you can always write it in the chat and we'll be able to respond to it. All right. So, first of all, um, we are working with Level 3 MD. And one thing I want to mention to start with is as technology advances, it's really important of cybersecurity in healthcare because cybersecurity in healthcare will continue to grow. So with the rise of telemedicine and the increasing use of electronic health record, EHR that we all know, healthcare providers must stay up to date on the latest cybersecurity threats and best practices. Myself, I am a nurse. I'm a registered nurse. I experience it almost every day. So what we need to know is we need to invest in cybersecurity now so healthcare providers can protect patient data and ensure the future of safe and secure healthcare. All right, so I'll leave it for Mr. Joseph right now.
All right, thank you, Farah. I am extremely excited about this topic because it is a very important one. Okay, so the first thing that I want to start with is really understanding why should healthcare professionals think about cybersecurity and why is that important, right? So first thing that we're going to talk about definitely it's a legal obligation that you have to comply with regulatory compliance when it comes in terms of HIPAA or in terms of any state specific regulatory laws or any other government body that protects sensitive information, such as personally identifiable information, which we'll touch on a little bit on. Okay, and as well, it is your ethical duty as a medical professional. You are dealing with people's lives, so it is your duty to make sure that the sensitive information that you have is protected because one manipulation of data can cause a lot of harm, right? And the next one, as far as a business perspective, without the proper cybersecurity, it may have financial devastation, right? There are a lot of things that goes on once your system is hacked or you have unauthorized disclosure of information. So therefore, there's a lot of risk that comes with that, and we'll touch a little bit on that as well, and as well as business continuity. So in the event that you have a cyber incident, your operation stops. We'll also touch in that as well. So these are the key components on why cybersecurity is crucial and important for medical professionals. So let's talk about a little bit more about your, state and federal legal regulations, right? As I mentioned, there are several states that have um, their own security standards and requirement when it comes to protecting sensitive information. For example, New York have the NY Shield that deals with protecting the residents of New York sensitive information, as well as California, to name a few. California have the CCPA, which is the California Consumer Privacy Act. These are some of the reasons why you need to protect the information is all the legal liability or the legal obligations that you have to do so. And next, as I said, it's an ethical duty, right? It's doing the right things versus the wrong things, right? As a medical professional, you are dealing with people's lives, right? So you have an ethical obligation to protect the information that they send you. So, perfect use case, if you think about it, let's say you prescribe a patient a particular dosage of a prescription, right? And then that information got manipulated, and then they changed the doses, the dose of that medication that was prescribed to that patient. So the next time it's time for a refill or anything like that, then you can see where it becomes a problem, or that information is not available at all to figure out, the patient history and things of that nature to know what was prescribed to it. So you have an ethical obligation to protect that information. And the financial devastation, as I mentioned, when you get a cyber attack, there are several fines that or several financial impact that it may have on your practice. And I'm going to name a few. First one that I can think of is definitely regulatory compliance or regulatory fines. I see there's a website that HHS has that have all the fines that all the different medical practices that are under investigation for HIPAA violations, right? And then from the civil side of things, your clients may take civil action against you, right? That's a cost as well. And responding to an incident and have its own cost and obviously downtime where you cannot bill your patients, or you cannot work, your staff cannot intake any new clients, you cannot see your patients and things of that nature. All that comes with a cost. And obviously the next thing is brand damage, where people may not want to come to your practice anymore because the information was out in the dark web or got compromised of some sort. So these are some of the risks that you want to think about when you're running a medical practice. These are some of the things that you need to think about. And as I mentioned, from a billing perspective and a business continuity perspective, is that when you're unable to see your patient because you don't have the systems to do so, it can take days or weeks without being able to conduct business. Can you imagine what that would do to your bottom line? These are some of the things that we as professionals, we have to think about when we talking about a strategic risk management solution. And let me take a moment to talk about what the cyber criminals are after, or what type of information that you need to protect. There are several types of critical information that you need to protect in your environment. So let's talk about HR, right? And I'm going to go into more details of each one of them. So you have HR data that needs to be protected. You have client personal identifiable information that needs to be protected, PII, and you have banking and billing information. You definitely don't want the bad guys to have access to your banking and financial information, right? And you also may want to protect your mergers and acquisitions, right? If you're in the process of either exiting your business, or if you're in the process of buying another business, they have to disclose a lot of information to you in order for you to do your due diligence and to be able to proceed with that transaction, right? If those informations get out in the public before they need to get out to the public, that can terminate the deal. So there's a lot of things, or even your competitors can take advantage of that. Last and not least, we're talking about healthcare, right? So medical records. That's another big one that needs to be protected, right? Again, these things not only they needs to be protected from a legal perspective, also they need to be protected from a business perspective as well. And so to touch a little bit more on the types of HR data that you want to think about, so think about your employees' personal identifiable information. It's not just your client, right? Your employees. You have the social security numbers, you have the addresses, you have the driver's license information. All that information needs to be protected, right? Uh, what about the salary? Right? They probably don't want that to be disclosed to any unauthorized information. So their salary and wages have to be protected as well. And the compensation history have to be protected. What about benefits and that they have enrolled? Like if you provide healthcare benefits, dental, vision, things of that nature, all that information needs to be protected, right? Payroll record is another crucial one that needs to be protected. Their tax information, W-2s and things of that nature needs to be protected. Or if they are a 1099 employees, you want to think about the W-9 information needs to be protected as well. And if applicable, any termination date, right? Your employees may not want that information to be out in the public, right? And now let's switch a little bit to some of the critical client data that needs to be protected. We were talking about the employees, your employees. Now let's talk about your client, right? So for your clients, the PI information that needs to be protected, obviously the names, address, phone numbers, email, gender, marital status, the dependent that they have, driver's license number, social security number, physical address, all that needs to be protected in order to make sure that you're managing your risk properly. And as I mentioned, like the billing and data sensitive information or banking sensitive information that needs to be protected, obviously your bank name, the address, the account number, the routing number, all that needs to be protected. What type of account it is a check-in, is it a savings, or if you are doing any direct deposit authorization forms that you may have, all that information needs to be protected. Any particular credit card information that you have on file, and particularly the card numbers, expiration date, and the security code that you may have if you're holding that information on behalf of your clients in order for you to bill them. That information has to be protected as well. And from merger and acquisition perspective, I want to touch on a little bit more on that, on some of the information that we see bad guys can take advantage of, and as well as some of the information that we make sure that our clients are protecting as well. So obviously, financial information is a big one. Operational information, the way the business is run, and any legal documents or regulatory information, those have to be protected. As I mentioned, human resources information, cybersecurity or technology systems information, all that needs to be protected, right? Any proprietary or systems that you have, such as your marketing plan or any industry specific information that needs to be protected, where your competitors may have that information and use it against you. So all that is a good examples of some merger and acquisition data that needs to be protected. Now, let's talk about one of the biggest things on why we're here is talking about, the critical medical assets that you have to protect it as a healthcare professional. So think about the patient demographic, right? address, name, phone number, age, all that information that needs to be protected. The medical history has to be protected. Clinical history, any chronic conditions that they may have, or any medication records that they may have, any mental health records that you may have on your patient, depends on what area of the medicine you practice or what area of healthcare you practice. Those information needs to be protected. Surgical procedures, things of that nature. And last but not least, if you are using an electronic healthcare record system, EHR, specific data have to be protected from that aspects as well, such as the logs, customer portal information when they log into the EHR systems, what they do, and as well as your staff interact with that environment. Those are some of the critical information that needs to be protected. And so now let's talk a little bit more about compliance. I think compliance is one of the biggest reasons why we're here, so you can comply with regulatory mandate. So for the medical health care industry, let's talk about HIPAA. HIPAA is a compliant body that's governed by the United States Department of Health and Human Services, right? And they have specific requirements on what it takes to comply with those requirements. I will touch on some of the steps and some of the things that they ask for when it comes to HIPAA later on during this presentation. And yes, and the next compliant body that I want to talk about is protecting people's sensitive information, personal identifiable information. So that part of compliance is actually being enforced by the Federal Trade Commission. So their goal is to make sure they are protect the American consumer sensitive information, right? And the third compliance that you may want to know about is any state-specific compliance that you have to think about. For example, as I mentioned, New York has their own, the New York Shield compliance. A quick story about that. There was a law firm that worked in the healthcare industry because they had a lot of sensitive information of the New York's residents' information, but the healthcare, the law firm company was out in Chicago. But guess what? Because they were doing business in New York with New York citizens and they fall under that compliance body, and they were hacked. So they were fined over $200,000 just for the New York State Department because of that breach, right? So think about all the different industries or the different states that you work with, and double check to make sure if they don't have any specific regulatory compliance that you need to meet in order so you can fully protect and manage your environment. So talking about a little bit more from a HIPAA regulatory compliance perspective, the goal is very simple, right? The goal of the federal government when it comes to HIPAA is to make it easier for health information to be protected, and also make it simple for people to get insurance, because some of these things, insurance can get very, very expensive, and due to that those crises, it is why the mission of the HIPAA regulatory laws. And I will touch a little bit more on who falls under those guidelines and in a little bit. So let's talk about who falls under HIPAA regulatory guidelines. So we have two types, right? We have what we call the covered entities, and we have what we call a business associate. So let me talk a little bit more about the covered entities first. So covered entities are healthcare plans, or healthcare clearinghouses, or healthcare providers. Those are fall under what we call the covered entity plan. So as long as they are electronically transmitting healthcare information to transact on behalf of a patient based on the um, HHS guidelines, they fall under the HIPAA standards, if that makes sense, right? And for the business associates, is any businesses or person that supports a covered entity, where they have access to process or work with protected healthcare information, then they would fall under what we call a business associate. So, for example, if you have an EHR system, so your EHR vendor may be a business associate to your practice, if that makes sense. Or if you're working with an IT services company or a cybersecurity company, then cybersecurity company would fall under those business associate component as well. And by the definition of HIPAA, if you are working with a vendor and between a business associates and a covered entity, and you don't have what we call a business agreement or business associate agreement in place, what you're actually doing is actually illegal. So HIPAA requires you to have a business associate agreement in place when you are working with third-party vendors that have access to where they can where you disclose health care protected information. All right. I know I've been talking a lot, and with that, Farah, I just wanted to take a break and see if we have any comments or questions coming in.
At this time, we do not. But one thing I want to highlight, like overall, healthcare organizations, what are they? They are prime target for cyber attacks, based on what Wilson just mentioned. They are prime target for cyber attacks due to vast amount of sensitive data, like patient data, and they are transmitted electronically, right? So in the healthcare system, as we use every day, either as patients or healthcare, CEOs or doctors, there are multiple entry points due to interconnected systems, including EHR, as mentioned, that is electronic health records. We also use medical devices and patient portal, for example, MyChart, right?
All right.
So legacy systems that are often outdated and also are vulnerable, they keep open for those type of attacks, right?
Right.
So as mentioned, what is the goal, right? Cyber criminals, once they steal this data and use it for they use it for identity theft, insurance fraud, and other malicious purposes. When we mention about data, or when Wilson mentioned about data, as he mentioned, like in summary, that includes names, addresses, social security numbers, medical history, and insurance information. Like in summary, that's what Wilson mentioned. And we deal with that day-to-day basis. So once you go to a medical practice, you give those information because we need it to store in our system, right? So he also mentioned PII, that is personal identifiable information, and PHI, which is protected health information. That are those information actually are extremely valuable on the black market, right? It's not important to us, we give it out, but it is valuable on the black market. In addition, what I can add is cyber attacks not only can disrupt healthcare operation, it can cause delays in patient care and potentially putting lives at risk, right? So therefore, as healthcare organizations, you must prioritize cybersecurity measures to protect against this risk, not only for yourself, for your patients, for your employees, and so on, right? And so
Absolutely.
that's what it is.
Awesome. Awesome. Thank you so much for the addition, Var. So now we know the risks. Now we know why it's important, because when you're dealing with people's lives, right, that people's lives, it's above everything else. Even in our cybersecurity trainings and certifications, that's what they talk about. Human life is the number one important things that you have to make sure that the safety measures are there, right? But now let's switch it up a little bit. I want to give you some tangible um, steps or action items of the standards that are required for you to be HIPAA compliant when you're in the medical field. So the first standard that we're going to talk about is going to be what we call a risk management process. What is that? A risk management process, there's a few things that you need to think about. And the things that I'm going to mention, they are required, right? There are two types of controls that we're going to talk about in a little bit. We have controls that are required, and we have controls that are addressable. You know, addressable doesn't mean it's an option. It doesn't mean optional, right? You have to do your due care and due diligence and to figure out what exactly it's reasonable for your environment. So that's one of the things, right? If it's feasible for you to implement those things, although they are what we call addressable, not required, we still recommend if they are feasible within a normal range of your capabilities, those should be mentioned, right? So the security process management is what it's looking for, right? It's you're looking for to make sure you conduct a risk analysis, which is one that's required. You make sure you want to do risk management. Okay, that is big. And you also want to do sanction policies as a part of your risk management program. You also want to have information system activity reviews. For example, who's logging into your systems, what they did, when it happened, all these things falls under those particular standards, right? And the second standard that I'm going to talk about is workspace security. So, workspace security, it means exactly what it means, right? Authorization and or supervision of a particular individuals. And these are some of the things that are addressable, right? You also want to have what we call a termination policy, right? The termination policy and termination procedures, all that fall under that information. Uh, Information, another standard would be information access management. So you want to make sure that healthcare records are isolated from everything else. You want to make sure you have the proper access authorization on who's accessing what and where, when, and how. You want to establish clear modification process on when something has been modified. How do you know about it? And the next standard that I always talk about, which is security awareness and training for your staff. Right? You want to make sure that they have reminders on when to take those on training. You want to make sure that uh, the software that they are using, they're not downloading anything malicious on your system. You want to make sure you train them on how to detect fraudulent activities. You want to monitor the login when they log into the system, and you also want to implement a password management solution as well. The next standard that is required, you want to have what we call an incident response procedure, right? That's respond and reporting different types of attacks and things of that nature when you do have an incident. And next standard that we know about is you have to have a business continuity plan in place. As I mentioned earlier, is one of the things that is required. You want to have the proper data backup plan. You want to have a disaster recovery plan, and you also want to have an emergency mode operational plan, right? In the event of an emergency, how do you operate your systems? And you want to test and revision those procedures periodically. So one thing about this requirement or this law, it really force you to be proactive. So you cannot be in a reactive state and thinking that you're going to comply with the HIPAA regulatory requirement. So you have to be proactive, right? And as I mentioned, which is a requirement, if you're working with business associates, right, you have to have a business associate agreement in place, right? It's a written contract or other arrangement, but it has to be on paper that it pretty much states that you are responsible for the security of your systems, and your third party a vendor is responsible for the own security of their own system as well. In the event that you're working with a service IT professional or cybersecurity professional, then we have what we call a responsibility model. The responsibility model really tells you what you as a covered entity responsible for, and what the cybersecurity services company is doing on your behalf. Right. So all that is a part of the plan as well. And um, there are three things that high level safeguards that is required under the HIPAA regulatory compliance, right? So the first one that I'm going to talk about is going to be your physical safeguards, right? The physical safeguard is really access to your facility. So it's access control for your facility, right? Who have access to what? Typically in an environment, you may have a server room where all your systems are monitored from. So you want to make sure the right people have access to those rooms, not everybody, and stuff like that. So you want to implement what we call a list privilege type of solution there. Only people with that needs access to that room should have access to that room. So think about your facility security plan. As I mentioned, access control, and then you have to maintain a record of who accessed those sensitive areas, especially where you're holding, patient record. So you want to have a record who's accessing those areas as well. And the second part of the physical security is the physical devices and media that you use, right? You want to properly dispose those information. So, for example, if you are working on a system that have critical information on it, so if the life cycle of this system is, it's done, then you may want to look at, if it's a hard drive that have sensitive information, you may want to look like shred that hard drive, right? And you also want to have accountability of the whole process of who get to shred the hard drive, how it's been done, and have it in a documented process. And the next thing that I want to talk about is definitely, you're going to hear that throughout my presentations. It's going to be backup, backup. Data backup and storage is one critical area of device and media control management as well. So that's for the physical. Now let's talk a little bit about the technical aspects of the safeguards. When it comes to control, you want to make sure everybody have their own unique username and passwords that needs to access sensitive information. So that way, that in the event something happened, you can trace it to a specific user. So sharing of credentials is definitely not recommended. So that's one of the requirements. And you want to make sure your emergency access procedures are in place, and you want to make sure you have automatic log offs, right? So if somebody's using a system, let's say they are working on a laptop, so that laptop should have, if that laptop is idle for more than 5 minutes or so, you want to have a screensaver that automatically comes into the system. All right. Um, so these are some of the things, and not but not least, the last one that I want to talk about is the last particular safeguard. We're talking about documentation, right? So administrative. You want to make sure everything, you have your policies and procedures in place. You have all your documentations are up to date, and and your staff are following the proper procedures when it comes to that. Um, with that said, I think that's all I had for today. Farah, is there anything else you would like to add?
The only thing I would like to add is, according to the US Department of Health and Human Services, HHS, in 2023 alone, there were over 630 ransomware incidents affecting healthcare worldwide, with more than 460 of these incidents impacting the US healthcare and public health. So we need to keep this in mind. And we need also to remember that by prioritizing cybersecurity, healthcare organizations like yourself can ensure safety and privacy of patients' data. That is all I wanted to add. And as always, I mean, did you want to add anything else, Wilson?
Yeah, I mean, thank you for put that out there, because just recently there was a breach, with a big organization in the healthcare industries. Even the some of the pharmacies were impacted. So you can imagine how major that is. I will not call out the entity name, but it definitely was public news. But yeah, so there's a lot of impacts when you know the right security measures are not in place, people's life can get, are at risk. Can you imagine that, getting your crucial medication that you need on a particular date and time because of incident? So this is why, for us, I'm very passionate about what we do, is to help and educate our clients, and help them to make the proper solutions that may work for them. So, with everything that I just said, if you have a need where you feel like you need to get in touch with us, I'm gonna go ahead and put our website here. I would encourage you to book a discovery call with us, and we can pretty much help you, help you protect your information. Right. So the discovery call is it lasts usually about 15 minutes. We get to understand your environment and see if we are a great fit to work together. And if we are a great fit to work together, in the next process along the line, we'll look to do what we call a security risk assessment. And then from there, we can know what are the gaps that you have, and make recommendations to help strategically protect your information. So This is a big topic. So if you are in the healthcare industry and you're looking for a partner to help you manage those risks, because the stakes is so high, reach out to us. We'll be more than happy to partner with you and help you alongside in this journey. And that's all I had, Fahad. Thank you.
Amazing. So as always, you can always reach out to us at 770-648-3399. And next week, actually, we have another big issue that we'll be discussing, and we have a special guest, special speaker. We'll be discussing cybersecurity and cryptocurrency. So if you are into cryptocurrency and you want to learn about it or have more information, and you don't want to know the link between cryptocurrency and cybersecurity, so we will be with you next week, 7 p.m. We are on YouTube, Facebook, Instagram, LinkedIn. So follow us, share the information, send us your referrals, and we'll be happy to talk to you. And thank you so much. As always, my name is Farah Joseph, and we also have Wilson Joseph. Thank you and have a great evening.
Take care. Bye bye.
Bye.